I would like to thank Lorenzo and Neil for inviting me to talk this morning. And I'm happy to be here, and I'm also a little quite nervous. So let's go with the presentation. This is the title of my presentation, Uncertainty and Global Sensitivity Analysis in Health Impact Assessment, an example in environmental epidemiology. Uncertainty, intended as a departure from a deterministic model, is not an accident in a scientific method, but is substantial, and there is no way to avoid it. Uncertainty evaluation is particularly important in health impact assessment. In fact, in this field, it's not unusual to combine different sources of information, and usually these information are affected by different kinds of uncertainty. Monte Carlo simulation and global sensitivity analysis are tools developed in other fields to treat and investigate uncertainty. However, these methods are not widely used in health impact assessment and in environmental health impact assessment. In particular, global sensitivity analysis is used in parasitology, environmental science, ecology, bioengineering, but there are, at the best of my knowledge, only few examples that use global sensitivity analysis in health impact assessment and in epidemiology. So the aim of this presentation is sharing with you my very first preliminary work on the use of global sensitivity analysis in health impact assessment, providing an example, a simple application in environmental epidemiology. My motivating example is a study that was published in 2015 on environmental health perspectives. This study involved all the municipalities of the Lombardy region of Italy for the year 2007. The study was aimed to assess the short-term impact on the total mortality of annual average levels of PM10 exceeding the WHO threshold recommended, the threshold recommended by WHO for this pollutant, the threshold of 20 microgram per cubic meter, and the European legislation limit of 40 microgram per cubic meter. The study evaluated also the contribution of intermunicipality commuting due to school or job reasons, but in this simple example, I will not consider this aspect, and I'll focus only on the city of Milan. Before starting, I need to define what I mean by model. For me, in this context, a model is a function that establishes a relationship between input quantities and one or more than outputs. So it's a function. The input is everything that can produce variation in the output. So in this sense, there is not a clear distinction between parameters and data. Both parameters and data can be considered input quantities. And I'll focus and I'll use this model according to a forward perspective. So I know the inputs quantity, I know the model, and I will use inputs and model to produce the output. This approach, this forward approach, is enough common in health impact assessment when we combine different information, level of air pollution, exposure response relationship, to evaluate, to calculate the number of events, for example, attributable to a certain exposure or year of life lost. The inputs of the model can be fixed quantity or can be affected by uncertainty. If the inputs are affected by uncertainty, I will define on these inputs a probability distribution. Here, the central issue is propagating the uncertainty from the input to the output quantities. There are several proposals in the literature to treat uncertainty, to propagate uncertainty. I will use a Monte Carlo approach. The Monte Carlo approach is very simple. I have one distribution, one probability distribution for each uncertain input. I will sample one value from each of these distributions. Then I'll use these values according to the model to calculate the inputs. If I repeat this procedure several times, I obtain a lot of values for the input. Then I will obtain a distribution for the output. Then I will obtain an entire distribution of values for the output. In my specific context, I have 5 inputs quantity and 1 output. My inputs are population size, which is treated as a fixed input. Then I have the crude mortality rate, the coefficient which expresses the effect of air pollutant, and then we have the average annual level of the air pollutant. These 3 input quantities are treated as uncertain inputs. And then I have the threshold. The threshold, which define the counterfactual scenarios and can be set to 20 or 40, 20 or 40 depending on the scenarios, is treated as a fixed input. My output is the number of attributable deaths per year. And this is my model. In the model, I accounted also for the intrinsic variability around the annual number of deaths, introducing a Poisson distribution. These are the distribution for my uncertain input. These distributions are obtained from quite complex Bayesian models that I will not describe here. If you want to, you can read the paper to know how we obtain these distributions. Then I sample from these 3 distributions, and according to the first model, I'm moving, so I don't know. Nowhere. So, according to the first model, where the threshold is fixed to 20, I obtain a distribution for the output. Then I do the same, and I obtain a distribution for the output under the second counterfactual scenario. This is my results. In 2007, in Milan, 269 deaths could have been avoided if the annual average level of PM10 did not exceed the threshold of 20 recommended by WHO. Similarly, 86 deaths could have been avoided if the annual average level of the same pollutant did not exceed the European legislation limit of 40. As you can see, I can calculate, according to the distribution of the output, a credibility interval for the two impacts. And the first credibility interval ranged from 145 to 418, and the second from 25 to 181. So this credibility interval are quite large. And so the natural question is, which is the relevance of each input quantities in determining the uncertainty around the outputs? And global sensitivity analysis can help in doing this kind of evaluation. Sensitivity analysis is the study of how uncertainty in the output of a model can be apportioned to different sources of uncertainty in the inputs. In particular, global sensitivity analysis is called global because it is based on an assessment which look at the entire input space rather than at a specific point in the space. In this sense, it's global. I'm not fixing a value, but I look at the entire space of the inputs quantities. The idea underlying the global sensitivity analysis is to decompose the total variance, which is the variance of the output, in several components, and then use these components to determine the most contributing factors. This is a problem of factor prioritization, to simplify the model and to investigate possible interactions. According to a result by Sobol, the total variance the variance of the output can be decomposed in several terms, in a sum of several variances. And these variances are increasing order. What I mean? For example, these first terms, the VI terms, are first order variance that depend only on one input, and the input is xi. So the first order variance is the variance of the conditional expected values of y given xi. The second order variances depend on two inputs, and so on. If we divide each of these components by the total variance, we can measure the proportion of the total variance which is due to the main, for example, in this case, if we look at the first order index, we can measure the proportion of the total variance, which is due to the main effect of the input xi on the output. If we consider the second order variances, we can calculate the second order indexes, and the second order index for xi and xj measures the proportion of the total variance which is due to the joint variation of xi and xj. So an interaction. In 1996, Homma and Saltelli introduced a new index, which is the total variance index. The total variance index for the input xi, that I call STI, is the sum of the first order or second order, third order indexes. In this sum, I included all the variances that involve the factor xi. The total variance index measures the proportion of the total variance which is due to the main effect of the input and to all its interaction with the other factors. Total variance index. If the total variance index, the condition that the total variance index is equal to 0, is necessary and sufficient for the input to be not influential. And if the input is not influential, this input can be treated as a fixed input. If the total variance index is equal to the first order index, this means that the interaction between the input and the other outputs is not relevant. Obviously, the total variance, the sum of all the total variance indexes can be larger than 1. I don't know, probably this is enough technical. I could try to explain with a small graph here, if you want. No? Okay. Maybe after. And how can we calculate these indexes? We can do through Monte Carlo simulation according to their definition in terms of expected and conditional expected values and variances. This is enough complex procedure, but we can use shortcuts that are implemented in our library sensitivity. So if you want to use this method, there is an R library. These are our results for Milan. When we use the counterfactual scenario of 20, we can see, here I reported the total variance index and the first order index for the 3 inputs quantity. We can see that the most relevant effect is related to the exposure response curve. So this is the source of uncertainty which is more important in determining the total variance. But also the level of P(n)(10) is enough important. On the contrary, the mortality rate is a negligible factor. This means that in our analysis can be treated the mortality rate as a fixed factor without loss of information. In this graph, I reported my Monte Carlo simulations in 2-dimensional space. For example, in this graph, I reported the value, the Monte Carlo simulation in the space defined by the output, the attributable depths, and the second input, the effect of air pollution. If in this graph we see a behavior, clear behavior, this means that our first order index is high. And in fact, this is the case. When there is not a clear behavior in this kind of graphs, like in this case, this means that the first order index is negligible. And in fact, this is the case. Another important thing is that in this case, total variant index and first order index are close one each other. This means that probably we have not an interaction effect. So the model is close to the additivity. These are the results for the second counterfactual scenario. In this case, we can see that the most important input is PM10, and the effect is not so important. So something changed. Moreover, there is a larger difference between total variance index and first order index that indicate the presence of a small interaction. Probably there is an interaction between inputs. And in order to investigate this interaction, we should calculate also the second order index. Discussion of the results, summarizing my result. I can see that our uncertainty is mainly due to the uncertainty around the annual average of PM10 and the exposure response curve. The variability around the crude mortality rate could be neglected, and this parameter could be treated as a fixed parameter. Due to the first order indexes are close to the total ones, we can conclude that the departure from additivity is not so relevant. Or we can conclude that there is not a strong interaction effect. When we look at the threshold, at the European Union threshold, PM10 alone explains most of the variability. When we look at the other counterfactual scenario, PM10 alone explains only the 21% of total variability, and the most relevant factor is the air pollution effect. So, how we can transfer our results in actions? If we are, in particular, if we are interested in estimating the impact in case of lower exposure, we need to improve our knowledge about the exposure-response relationship. Because in this case, this is the most relevant source of uncertainty. If we are interested in estimating the impact for higher level of air pollutant, we need to ask local institutions to increase the number of monitors that measure air pollution, or we need to collect more information to improve our knowledge around this parameter. We found that uncertainty around the mortality rates is not relevant, so we can treat this parameter as a fixed parameter. But as an alternative, we could try to specify a more complex model that estimates group-specific mortality according to socioeconomic condition or frailty of the population. Which are the limitations of this analysis? I adopted a very, very simple model only 3 inputs, to treat a very complex phenomenon, the impact of air pollution. And I use very standard methods for global sensitivity analysis without exploring other and more recent possibilities. I did not, finally, and most important, I did not consider uncertainty about the specification of my model. For example, is the relationship between PM10 and mortality linear on a log scale, as I assume? Which is the role of possible effect modifiers in this model? So, general conclusions. Monte Carlo methods and global sensitivity analysis are useful tools in environmental health impact assessment and should be run in tandem. Moreover, global sensitivity analysis should be communicated together with the main finding of health impact assessment in order to show that, in some sense, uncertainty is not completely obscure, but can be treated and explained. Global sensitivity analysis can help us to take action to reduce uncertainty, for example, provide some indication in this sense. For example, changing study design or collecting more data. And can give indications regarding simplification or modification of the model, of the original model. Final remarks, and this is my last slide. Global sensitivity analysis focuses on a quantitative assessment of uncertainty, but we know that uncertainty occurs in different locations during our knowledge process. When we conceptualize the problem, in the analysis, and also when we communicate the results. So my conclusion is that global sensitivity analysis is useful, but is not a panacea, in the sense that if we want to study uncertainty, we need integrated approaches and participatory approaches that help us to better understand the nature of uncertainty and their practical implication. Also considering that uncertainty sometimes cannot be expressed in a numerical way. So I finished my presentation. Thank you. I'm sorry.